Thank you for joining today's lecture on inflammation, inflammatory markers, and the potential for exosomes to lower inflammation. This presentation is for educational purposes only. It is not intended to diagnose, treat, cure, or prevent any medical condition and does not commercialize any zeoscientifics or any other products. It is based on a review of published clinical studies. The body's immune response to injury, infection, or harmful stimuli. It can be acute, which is short-term, or chronic, which is long-term and associated with diseases like arthritis, cardiovascular disease, and autoimmune disorders. Inflammatory markers provide measurable insights into the presence and severity of inflammation. They help guide treatment and assess the efficacy of interventions. CRP is a marker of inflammation. Normal range, less than 3.0 milligrams per litre. ESR, or erythrocyte sedimentation rate, is a blood test that can reveal inflammatory activity in your body. It measures the rate at which red blood cells sediment. Normal range, 0 to 20 millimeters per hour for men, 0 to 30 millimeters per hour for women. Interleukin-6, IL-6. IL-6 is a cytokine involved in inflammation. Normal range, less than 7 picograms per milliliter. Ferritin. Ferritin is a blood protein that contains iron. Normal range, 20-500 ng/ml for men, 20-200 ng/ml for women. Tumor necrosis factor alpha, TNFA. TNFA is a cytokine involved in systemic inflammation. Normal range, less than 8.1 pg/ml. Procalcitonin. Procalcitonin is a marker of bacterial infection. Normal range, less than 0.1 nanograms per milliliter. In multiple clinical studies, exosomes have demonstrated the ability to lower the following inflammatory markers. Anti-inflammatory effects, rich in IL-10 and TGF-beta, which reduce pro-inflammatory cytokines like IL-6 and TNF-alpha. Immunomodulation, shift macrophages from pro-inflammatory or M1 to anti-inflammatory or M2 states. Liver function regulation reduces CRP production by modulating inflammatory pathways. Cellular repair and regeneration delivers microRNAs such as MAR146A to suppress inflammation and promote tissue healing. Oxidative stress reduction neutralizes ROS with antioxidant enzymes, reducing oxidative damage. CRP decreases liver-induced CRP synthesis. ESR reduces systemic cytokines, leading to normalized ESR-IL-6, direct inhibition of its production. Ferritin lowers levels by reducing systemic inflammation and oxidative stress. TNF-alpha downregulates production via microRNAs. Animal studies show reductions in CRP and systemic inflammation in arthritis, cardiovascular disease, and autoimmune disorders. Many clinical studies demonstrate exosome therapy lowers inflammation associated with the following conditions. Improvements in inflammatory markers have been observed in osteoarthritis, metabolic syndrome, and inflammatory bowel disease. Rheumatoid arthritis, lupus, skin conditions, sexual dysfunction, hair loss. Ah yes, metabolic syndromes. These are, well, conditions that can significantly impact one's health. Among the most common are type 2 diabetes and obesity. Alzheimer's disease, multiple osteoarthritis, tendinitis. Exosome therapy modulates inflammatory pathways, reduces markers like CRP and IL-6, and promotes tissue repair. Clinical evidence supports its use in managing inflammation across various conditions. Ongoing research and clinical trials are refining protocols and further validating therapeutic efficacy. Exosome therapy lowers inflammation in all of the inflammatory markers listed in all of the inflammatory markers discussed. These markers include C-reactive protein, CRP, erythrocyte sedimentation rate, ESR, interleukin-6, IL-6, ferritin, tumor necrosis factor alpha, TNFA, and procalcitonin.